Today, digital orthodontics is becoming more and more popular. Whether you use Insignia, Invisalign, SureSmile, or eye braces, the quality of the impression is directly proportional to the quality of treatment. It turns out that digital orthodontics is all about the impression. The unique PlanetSmiles impression is the only system designed exclusively for full-arch digital orthodontic impressions. This video will show you a simple technique using these engineered materials to get a repeatable, accurate digital impression every time. Patient prep is a simple three-step process. First, lipstick or lip balm will stop the material from setting, so be sure to ask the patient to remove either of these. Second, have the patient brush to make sure that the teeth are clean. And finally, have the patient rinse with mouthwash to eliminate any ropey saliva. Begin by taking one level scoop of each of the two putties and kneading them together until the color is even. Then roll the putty into a cylinder and press it gently into the plastic impression tray. Press the spacer into the putty. Push the spacer into the putty so it sticks and won't move during tray insertion. It should look something like this when you're done. And now we're ready to take the impression.
Okay, go ahead and open big for me and just relax. I'm going to push down kind of hard. Okay, go ahead and bite down. Perfect.
This is a good time to stop and explain the secret of PlanetSmiles impressions. First, the stiffness of the putty is matched to work with the softness of the spacer. Together, they create a custom-fitting tray for your patient. That's why it's key to have the patient bite down completely into the tray. When the tray is removed, you should see a completely deep impression. You should see the occlusal surface of the tray visible in a few places where the teeth have made contact with the tray. This tray now has a uniform gap between the patient's teeth and the putty. Since the spacer gap is repeatable, it's been possible to design the wash material viscosity so when you take the wash impression, the hydraulic force generated drives the material to get superb, uniform, and detailed impressions. By seeing how the final impression is constructed, you can understand why these impressions are so much more reliable compared to other PVS techniques. Check the putty to be sure it's set, and then remove the tray from the mouth and the spacer from the tray. Before loading the tray, squirt out a small dollop somewhere convenient to purge the cartridge of air and to check that the material is set before tray removal. Inject the head of the tip while keeping the tip embedded in the wash. The putty and spacer have created a custom tray, and the spacer has kept the putty reasonably dry as well. On a medium tray, you want to use a little more than a third of a cartridge and a little bit more than that on a large tray.
Okay, now I'm going to go ahead and take your impression, open really big for me, and just relax. Breathe through your nose, stay open, do not close, and I'm going to hold it in place. It takes about 2 minutes for it to set up.
On this wash impression, tell the patient not to bite down onto the tray and just seat the tray gently and completely as you would with any other impression.
And open big, and just stay open. Again, just relax and breathe through your nose.
Finally, you'll need to check the impression. For this, you'll need good lighting and some sort of magnification. You can use clinical loupes like those from Oroscoptic. If you don't have those, we suggest high-quality magnifiers like these, which are inexpensive and available from PlanetSmiles. You would like to see only wash material, but if you can see small islands of putty showing through the wash, don't be too concerned. Be sure to test your skills before working on patients. 1 or 2 test impressions is usually enough for most people. If you follow these instructions, you should be well on your way to great digital impressions.